Hi everyone, welcome to our last summary for HSAM 2400. Hopefully you've enjoyed the class. I've certainly enjoyed working with everyone this term, and hopefully you've picked up a few pieces of information that perhaps you didn't know before. So just want to go over a couple quick things, and I'll go over a few quiz questions. So this past week we talked about kind of the legal ethical responsibilities of a couple of different aspects of healthcare. So the medical professional side of things, and then also the hospital side of things were part of our learning from last week. But I also wanted to, if you didn't watch this video, it's an interesting video. This drugging dementia video can really raise some awareness about treatment. Uh, Poor treatment or maybe inappropriate treatment in our long-term care facilities. So I think it's worth taking a look at. It's just an interesting, it's, not by any, it's not 60 Minutes or any great investigatory journalism, but I thought the story itself was pretty interesting and worth taking a quick look at. Also, we had our EMTALA discussion from last week. The key with EMTALA is that some people have a misunderstanding of what EMTALA is. Misunderstanding the fact that you get free treatment, which you don't. Even if you do report to a facility and have treatment under the EMTALA guidelines, you still are responsible for that financially. You may be able to get, if you don't have insurance and you meet certain financial requirements, low income, those types of things, you may be able to get a discount or even free care if the hospital you're dealing with offers that. To be a Medicare hospital in today's world, you actually are required to offer financial assistance if you're nonprofit. But it's there's just kind of some misunderstandings or lack of understanding about EMTALA overall. So a situation like we saw here in case number 3, where the patient reports they had a medical screening exam, there was no emergency deemed by the qualified medical provider that provided that screening exam, and they sent them out to go to another facility. Some people see that and they think that there's an EMTALA violation, and there's actually not. The question there is not necessarily the legal issue, because there isn't, but also the ethical issue. If a patient reports thinking that they have an emergency condition, should care be provided regardless? This case number 3 is one that kind of raises that question. And honestly, from my personal perspective, I think that they're actually doing this patient a favor by encouraging them to seek care at the urgent care facility, because the cost would be much less. And obviously, this is an uninsured patient. So just an interesting caveat there. Obviously, the top 2 cases were EMTALA violations. This patient was not provided a medical screening exam. They just had triage. This patient, that's a huge issue overall. But the bottom one was not an EMTALA violation, but there is some question about the ethics of all of those cases. So looking forward to obviously it's just Monday morning. I haven't looked at your final projects yet, but I'm really looking forward to taking a look at them. I know everyone had some really neat topics, so I'm looking forward to seeing what you have to say. For week 8, just a few brief reminders. Our week ends on Friday this week, which I think is the 3rd, perhaps. So make sure you have your discussions and your quiz and whatnot in by Friday. Saturday, your new classes will start if you're taking summer classes, so be prepared for that. Well, they normally start on Saturday. I thought I heard someone say something about Tuesday. I'm actually not teaching in the first 8 weeks this summer, so I'm not exactly sure, but be sure that you are aware of when your classes start and you get to work on them next week. For our first discussion, we're actually reviewing our work this week surrounds labor relations and human resources. So obviously both areas that are important to healthcare, important to any industry, but we need to be aware of discriminatory practices, harassment, dealing with labor relations, which is typically dealing with unions. So all important aspects that many nurses are unionized across this country, as well as other workers in your facility. So an important topic, and we have a case study that we're going to take a look at for our discussion. So we have our case study that we'll review. There's also an optional discussion. It's a regular written discussion board. It's completely optional. There are no points assigned, but if you would be willing to provide us with some feedback, I would love to hear what you have to say. Obviously, you have your formal feedback mechanism, your course surveys, which you've hopefully received emails about. But this is kind of a little more informal. You can give a bit more detail about things you like, things you didn't, the ways that we can improve, other topics you'd like to hear about. This can really help us to continue to improve our classes over the time. And then you have a quiz this week as well, and obviously this video, which will go up there as soon as I'm done with it. So just a few quick aspects of the quiz I wanted to go over. So there we go. So the first question, there were 3 questions I wanted to review. Generally, everyone did pretty well on the quiz, so there wasn't a lot to review, but I did just want to go over a couple of the questions. So first question is, the ultimate authority for granting clinical privileges rests with thee. So our correct answer was governing body. And what's important to realize about any facility, really, any organization that is run by a board of directors, board of trustees, governing board, whatever it happens to be, ultimately they are responsible. So the CEO will report to the governing body. The governing body hires the CEO, and they report to that person. And then ultimately, they are responsible for granting privileges for the operations of the facility. That's why when you see an organization that has a significant issue, maybe a huge compliance issue, or we're seeing some issues with regard to embezzlement and those types of things in a local healthcare system here to the Western PA area. Those types of things, the ultimate authority for everything really rests with the governing body. And that's why it is taking a position on a governing board is not something that you should do lightly. You should always be comfortable with the ethical and moral behavior of the facility overall, with the fact that they are working diligently to remain compliant with legal and regulatory requirements, etc. So although the medical president of medical staff, CEO, any executive team of the medical staff, they all have a say in granting privileges. Ultimately, the governing body is who is responsible. So from a credentialing standpoint, you need to make sure as a governing body member, you need to do your due diligence to make sure that they are only bringing and offering privileges to medical professionals that are appropriately licensed, that haven't had significant issues with negligence in the past, etc. Because ultimately, you are responsible for all of that. Second question, medication errors can be decreased by, lots of different answers here, but our correct answer is writing abbreviations according to hospital policy. And one thing that's really interesting in obviously your learning that you've done thus far in healthcare, hopefully you have noticed that we use a huge number of abbreviations and acronyms in the healthcare world. And unfortunately, there are sometimes when those abbreviations or acronyms, we use the same letters for 2 different things. So every hospital is going to have, or should have, a policy that details what abbreviations are allowed within their facility. And if you're writing in the medical record or writing orders to that facility, these are the only abbreviations you can use. So really important that medical professionals that are operating within a facility, be it nursing staff, physician staff, non-physician practitioners, therapists, counselors, etc., they all need to be aware of what the policy is and make sure that they are writing to that the letter of that policy. So by using the abbreviations that are provided, it can help to decrease medical errors, medication errors, and medical errors overall, actually, but medication errors. The one answer, and I think it was just a quick read of the question, this is the answer that if people got it wrong, they chose this. Ensuring handwriting is illegible. We certainly wouldn't want that, although that tended to be the case when we had a lot of handwritten notes, that the handwriting was illegible. We want handwriting to be legible. So I think it was just folks that answered that. It was just a quick read of it. You saw legible and that you thought that was the correct answer. But obviously this was the incorrect answer because we want handwriting to be legible, not illegible. So that's that one. One more. A physician is, lots of different answers here, but the correct answer is negligent if his or her treatment is not performed as required by the recognized standard of care. So kind of rewind back to either week 1 or week 2 when we talked about torts and specifically the tort of negligence. So when we talked about negligence, we learned that in order to prosecute negligence, there needs to be a duty to care, and we need to have a breach of that duty. So, and the duty to care is that that recognized standard of care that a reasonably prudent person would have expected that to be the level of care. So, so this is our answer, and is important because if treatment by a physician is not performed as required by the standard of care, then we have breached that duty of care and therefore the negligence has occurred. I think this was the other answer that I saw people choose. A physician is expected to perform novel procedures if he or she decides to do so, regardless of the medical standard. That's not the case at all. We do have people that do perform novel procedures, new things, research, and that's great for those that do, but it's certainly not an expectation. And from a negligence standpoint, we need to just meet the standard of care. Novel procedures or new procedures are certainly not the standard of care. They would be above and beyond that. So this answer here, negligent by the mere fact that an adverse result occurred, not the case. Sadly, we're always going to have a certain percentage of adverse results, even when we do meet the standard of care, and expected to guarantee the results of his or her treatment. Again, sadly, no. No provider can guarantee the results of their treatment. I've always said that I used to do a lot of research compliance work, and I always said that that medicine overall in healthcare is as much an art as it is a science. Much of what we do, especially when we're talking about research, novel procedures, novel drugs, novel medical devices, they're not, it's unknown how things will react with various people. It's unknown. There are so many unknowns in healthcare. It is certainly could never be guaranteed that someone could see results from the treatment that is being provided by a physician. So that's all I've got. Hopefully, again, you've learned a few things throughout this class. I think that this is a course that can really give you hopefully a good legal basis to work forward from. You'll certainly learn more about the law and various other aspects of our coursework in the HSA program if you are an HSA major. But I'm also hopefully it gave you a good basis to work from an ethical and moral standpoint, understanding how important moral and ethical behavior is in our industry. People come to us to receive care, and it is our duty to owe them, or we do owe them that that we're meeting that level of care that is expected and provided. There are always going to be people that are displeased with, you can't please everyone, I guess is the saying. So there are always going to be people that seek care from us that are displeased with the care they received. But we have that duty to care to the reasonably prudent person standard. And if we do that and we do it in a moral and ethical manner, I think that I think we're in good shape. So it's been a pleasure again working with everybody this term. I hope that you enjoyed the class. Hope to see everyone in another HSA class in the future. For those of you, I don't think we have anyone in this class that's graduating, but if we do, congrats. congrats. I sadly will not be at graduation. I will be at my son's graduation from Syracuse. But if you are graduating, congrats. And so I won't see you in another class. But if there's ever anything I can do to help you in your career, or further schooling, please just let me know. And don't forget that we have a master's program in health administration here as well. So please think about coming back and joining us for that program also. So everyone have a great week, and don't forget Friday is the last day to submit assignments. Okay, thanks so much.